So for today's medication, I'm going to be giving the drug cefotaxime. So I'm going to look at the patients. I'm going to make sure that the drug is transcribed correctly from the physician's order sheet to the MAR, which it is. So we've done that check. I want to know the patient's diagnosis. They came in for community-acquired pneumonia, so we're trying a bacterial infection for that, which is why we're getting the antibiotic. So the patient also has no known drug allergies, which I can see from the MAR. I'm going to perform hand hygiene and then select my vials from the Pyxis. So I have cefotaxime, a 1 gram vial, and normal sterile water for reconstitution. The vials aren't expired and they are intact. So for part of my first check here, I have right patient Andre Olivares, right drug is cefotaxime, right dose 750 milligrams of a 1 gram vial, right route is IV, for IV. Time and frequency is every 4 hours. It hasn't been given yet, so I can give it now. Okay, so looking at the parenteral drug monograph for cefotaxime, it is an antibiotic, so that's why we're taking it for the bacterial infection. It can be administered by a student nurse. The usual dose is 1 to 2 grams IV every 4 to 8 hours. Maximum single dose is 2 grams, maximum daily dose is 12 grams. Reconstitute 1 gram, and for reconstitution 1 gram with 9.6 milliliters sterile water for injection. Final volume of 10, final concentration 100 milligrams per milliliter. So we will do that. And for IV intermittent, diluting 25 to 100 milliliters normal saline. I administer over 15 to 30 minutes. I've chosen a 100 milliliter bag of normal saline because they have no fluid restrictions, and I'm going to give it over 30 minutes to allow myself time in case anything happened. It's compatible with normal saline. I checked beforehand. That's the primary I have running now. It's running at the correct rate and it's not expired. So that's good. It's also compatible with our mini bag. Potential hazards would be cardiac dysrhythmia, rash, diarrhea, vomiting, hypersensitive reactions, so we'll watch for all of those. So now, and again, before I would have picked these up, I would have done hand hygiene. So I'm going to do hand hygiene again. So I'm going to now start preparing. So I'm going to swab these for 30 seconds, let dry for 15. I'm just speeding up for the purpose of this video. Swab for 30 seconds, let dry for 15. So that's going, I'm going to look back at the reconstitution. I had to add 9.6 milliliters of sterile water for the injection. So I'm getting my 10 milliliter syringe. Okay, so now I'm pulling back the 9.6 line. And now that these are dry, I'm going to inject air. So I need to pull back to the 9.6. And I want no bubbles because I want to make sure I'm doing the reconstitution right, so they're actually getting dose. Okay, so now that that is good, I'm going to inject that right into the cefotaxime vial. Relieving air pressure. Okay, cap. So now I'm rolling this to make sure that it's dissolved, that all the medication's mixed, which it is. So for the calculations, if I had, after reconstitution, I had a final concentration of 100 milligrams per milliliter, I need to draw up 7.5 milliliters of the medication to get that dose, because I need 750 milligram dose, so I'm drawing up 7.5 milliliters. So I'm going to put that to the 7.5 line in between the 4 and the 6, and then swabbing this for 30 and letting dry for 15 just in case. Perfect. Okay, so now I'm going to recap that. There you go. And then, so I'm just going to do my second med check here. So I'm looking at the parenteral drug monograph. So we have cefotaxime. I just want to make sure we did the reconstitution right. I added 9.6 milliliters of sterile water for a final concentration of 100 milligrams per milliliter. If I needed a 750 milligram dose, I should have drawn up 7.5 milliliters. So I'm going to look, which I did. And again, we had cefotaxime. For the MAR here, I have right patient Andre Olivares, right drug cefotaxime. Right dose is 750 milligrams, which we drew up 7.5 milliliters. Right route is IV. Right time and frequency is every 4 hours. It has not been given yet, so it is safe to give now. Okay, so, and then we'd also want to make sure that